Hello, everybody. Welcome back to How Come? Oh, man. This week's episode is late because I got back to Portland and Grace sat on my computer and I didn't want to move her so that she'd hate me. She still hates me and the episode's late. But whatever. This is an amazing episode. It's actually one of our most requested of all time. We are diving into SSRIs and sexual dysfunction. If you don't know what SSRIs are, they are selective serotonin reuptake inhibitors, anti-depressants. And yeah, there's been a lot of people coming to us being like, can you do SSRIs and not feeling horny or not being able to come? And that's what we're doing on this episode with comedian Andrew Collin and psychiatrist and integrative medicine specialist Dr. Barbara Bartlik. And it's going to be an amazing episode because Andrew suffers from SSRIs, not being able to come as much as he'd like to. And Dr. Bartlik treats that. Also, happy almost Mother's Day. And isn't it so exciting because Dr. Barbara Bartlik also happens to be mother to another guest on this podcast, comedian Betsy Carroll, my friend, who was on season 1, episode 7. So thank you, Dr. Bartlik, for this episode and for my friend Betsy. Dr. Bartlik also has over 3 decades of experience in clinical practice in Manhattan. She uses mainstream medication, psychotherapy, cutting-edge technologies, and natural therapies. And she treats way more than sex therapy. So if you are in need of a therapist in New York, go check her out. Our other guest is comedian Andrew Collin, as I said. You might know him from his podcast Puddles or co-hosting the Nikki Glazer podcast. Or you might know him from our episode him and Nikki did together, our live show, which is only available on patreon.com/howcome. Great episode. And yeah, our companion congratulations this week is Natalie from Northern California, who I met at my show in Carmel on the tour with Ashley, and she brought me gifts, and she's so cool, and she's so nice. She brought me a Zippo lighter and this drink called Uncrushables. It's like Uncrustables, but alcoholic. Also, Robin brought it to my attention that Uncrustables are not a thing anywhere but the U.S. But they're great, and you should try them if you can get your hands on them. And yeah, anyway, this whole episode's so good, and we love it. And I just want to give a shout out to Dame Products. I love you, Dame Products. Dame's mission is cultivating pleasure to enrich well-being. For satisfaction literally guaranteed and 15% off, head to dameproducts.com/howcome.
How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh baby, I believe these guests can help. 'Cause I can't do it by myself. I wanna jizz.
Welcome, Natalie.
Hi.
Hello.
So nice to see you again.
I know. Nice to see you too.
We actually met in person. This is very exciting.
Sad react.
Oh, yeah. Thank you so much for coming.
Of course.
Before we met in person, when I was just a little voice in your ear, what was your how come journey like?
Basically, I don't know, I was kind of sheltered as a child, and I don't know, talking about like sex was always something that you just like, I don't know, it just doesn't happen.
Mm-hmm.
But I became active a little bit in high school. I had like a high school sweetheart.
Mm-hmm.
And then that was my first kiss. And then we kind of messed around. Yeah. And we would like foreplay for hours.
Okay.
And he was a really good first boyfriend, like really respected my boundaries. I was kind of like you. I didn't want to do anything with dicks. And so I was just like, I just don't want, I don't know. It just kind of freaked me out. I grew up with all girls. Like, I mean, I had 2 sisters and then our single mom. And so I was just always around women. I never had like a man in my life. So
no dicks.
Yeah. So I was like it was intimidating. And I had a sex ed teacher who just decided to skip all that in high school.
Where did you grow up?
How?
I grew up here. I know. I went to a private school, so
In California.
In Carmel?
in California. No, not Carmel, in Santa Cruz. Well, I say Santa Cruz, but it's more like Watsonville. But
We met in
north.
Carmel.
Yeah, we met in Carmel, so only like 30 minutes away.
Okay.
But yeah, the teacher just decided she wasn't going to teach that. I guess she got really red and like blushy, and is that even a word? I don't know. She blushed a lot.
Yeah.
Yeah, I guess it was her first time teaching it, so it made her uncomfortable to talk about it.
So she just
So
skipped
the
it.
next semester she was like, I'm just not going to do that.
Oh
So I
my
didn't really.
God, what a horrible
I know.
cycle. Like
I know.
one person is just afraid and then like a bunch of kids miss out on sex
Just
ed.
don't learn it.
Yeah, it was terrible.
Okay.
Yeah. So didn't talk to anybody about sex like ever.
Mhm.
And then I lost my virginity when I was 21 to the boyfriend I have now. And I don't know, just like I never knew, I was never taught that like my orgasms were, a priority.
Mhm. So you never came with boyfriend number 1.
No.
Just a lot of foreplay.
Yeah, and it was fun. I was like, I like this. But like it always felt like,
What type of
kind of like-
foreplay, can I ask? Like,
yeah. Just like we would, I don't know, just like grind and kiss and
it's my friend screaming.
Oh, no, you're right.
Say that, Tim.
Yeah, it's Tim.
Yeah. So it was just good fun, and I knew that I liked it.
Grinding and making out, but no like fingering.
Naked.
Oh, being naked?
Yeah.
Okay. This sounds
Maybe-
great. This
maybe
also
there
sounds
was
very
fingering.
conducive to orgasms.
I think I was getting fingered.
Mm-hmm.
I think so. I don't know. And so then I started having sex as an adult. I don't know. That's when I got a boyfriend again. So I always felt like I was like going through these waves. Like I was on a wave and I was like surfing the wave, and like it was building up, and then I'd hit a wall. And then it just like the feeling and the sensation would go away. I don't know if that makes sense.
No, I can like see that very visually.
It was great.
Yeah. So that's what I was like, oh, like, and then when I was like, when that sensation would happen, it like didn't happen very often, but when it did happen, I'd get really frustrated, and I just like wanted it to be over. I was like we're done. Like I'm so mad right now.
I feel the same way. I feel like I haven't even like summarized it that way. And it would like, I was like fucking pissed. And like, it's because you would get right fucking there. And then like this, all it slides down.
Yeah. So I knew that something wasn't working.
Mm-hmm.
And then I can't remember, I think I was on Instagram and someone like said like, I'm bored right now and tell me your favorite podcast. And then they shared the podcast, and then that's how I found How Come.
Oh, so you weren't even like seeking out a cum.
No.
Amazing.
No, I wasn't. It just,
It found you.
Yeah. And then
came
the
to
first
you.
episode, the first episode that I listened to, the one with Dan Savage, had just come out. So it was season 2.
Yeah.
So I was listening to that and I was like, oh my God, I'm like hooked. So then I listened to season 1, episode 1, and this is embarrassing, but I like got so uncomfortable with what's her name? Wendy?
Yeah.
Is that her? Okay.
Yeah.
The way that, this is just me because I couldn't hear the word pussy or clit or anything.
I used to
would
feel the
cringe.
same exact way, honestly.
Okay.
Interesting.
My ears would like kind of shrivel up when I heard those words. But then also when I watched like, I don't know, Grey's Anatomy or something like that, like doctor shows, and I saw like surgery happening, like I could feel it in me. Like that, like, I don't know. It was like I would get really sympathetic.
Okay.
And I was like,
visceral
I just don't like it.
pains in the body and ear.
And so, And so then when Wendy was talking about, like being, I don't know, really, really young, and like having an orgasm, I was like, oh my God, I can't listen to this. Like, but then I was like, wait.
Because you felt like you were a child having an orgasm.
I was just, I don't know. I was like, oh my God, like my mind, it was almost like the orgasms that I was about to have. Like I would like get really into it, but then I'd hit the wall. And I'm like, so when I heard her words, I felt it emotionally. And then I was like, I just have to get through it. And then I got through the episode, and then I kept getting through all the episodes. And now I say pussy, and now I say clit. Like now it's like, I know. So like, and I did like, there's this one song I don't even know what it's called. I think it's like called H2O or water. I can't even tell you the artist, but he says pussy like 20 times in the chorus. And I just made myself sit and listen.
Honestly, no, like some people might be listening to this and like, are like, oh my God, like I don't get that at all. Like I get this 100%. Like, I don't know if I think I did mention this on the first episode, but like I always associated pussy with like a bad thing, you know, like pussy, like fucking gross, you know, like really like, ugh. Like the fact that I can sing along to WAP and not be grossed out, like momentous occasion for me when I realized I could do that. Like my neck, my back used to make me like, ugh, like, you know, like anything, like clit. I was thinking about this early this morning because somebody said my lit agent, and I was like, what about your clit agent? And I thought back, I was like, 5 years ago, you would not have said this. I did not feel like clitoris was a word for me to say. Like, what? If not me, then who?
Legit.
Like we have them. We should talk about them. And I don't know like how or like if it was intended by the patriarchy or society for things to sound worse or more graphic so that we didn't talk about them and that we didn't get to this point that we were like super liberated, but like it worked. You know, like we definitely, you and I would have had more conversations with people if we felt like they were our conversations. Yeah,
exactly. Like I felt like that was only something like that men would say when they're only putting other men down. So, so I made myself listen to that song, listen to the episodes.
Through.
It wasn't hard to do though. Like I really enjoyed like listening to the show. And then I was like, I just need to start speaking up for myself. And so then in my relationship, I was like, I'm not coming. Like, do you think I come? And he was like, no, I know. And then I'm like, okay, then we need to start doing something about this. And so then I was like, you should listen to this podcast. Like, it's amazing. Like, I love listening to it. I think you'd like it. And so then, he used to take the train to school, like to San Jose State. And so he would just like send me screenshots of like every episode that he like started listening to.
Oh my God.
I love that.
Yeah. And then the sex got better. And last year, 2020, in the summer, he was like, I got you a surprise. He was like, it's no big deal. Like, because we didn't know when we were going to see each other next because of the pandemic.
Oh
so
my God.
He just was trying to play it down. So that way I'm like, where's my surprise? Where's my surprise?
Yeah.
Not that but I was like, ugh. Okay, because I just don't like gifts. But then
or some people don't like surprises. Like just I don't like give it to me or don't give it to me.
Yeah, exactly. So I was like, oh, okay. Like, but so he knew that, so he downplayed it, and then it was this, and I was like so pumped. I didn't get to use it that day, and then I was just on cloud 9 because of it. And then I went to work the next day, and this is like kind of doesn't have to do with anything, but it does. But my best friend at work, who was a manager, got fired.
Okay. And that made
everyone, no. Everyone
she
was like devastated. I love her so much. We actually have like wedding rings that we say we have. So, but anyway, so I was like, I was planning on going home and using it that night. But then when I got that news, I was devastated. Everyone was devastated. So we all went out and like I just kept thinking about at home. And then I just like word vomited and like told my coworkers about how I hadn't come yet. And they were like, oh my God, like what? You need to do something about that. And I was like, yeah, I know. So then I told them about this, and oh my, like, it was just like the best I had never had a good conversation like that. And it was honestly because of the podcast. Like, I wouldn't have been able to open up to other women if it weren't for me, like, hearing you and other people
she hadn't
talk about
gotten
it.
fired.
Because she was fired.
Because she was fired.
So then the next morning I was like, oh, I'm like alone in the house. So I was like, okay, I'm going to like do what's a master date when you like make it all nice.
Yeah.
Well, and I had done that for myself in the past, but this time I was like, no, I'm not going to do that. Like, I like just like got in bed and I got and I was like laying down and it wasn't working. And I was like, this is really frustrating, but I just wasn't using it right. So like I went to the bathroom and I stood up and I was like, I'm going to try standing up.
You got to do it in the bathroom standing up for the first time.
So I'm going to do it standing up. And literally I put it on my clit and it was the suction one. I don't know.
It's a good one.
Yeah. So I was standing up and I put it on me, and right away, like in 5 seconds, my legs were like wobbling. And I was like, I couldn't stand. And I basically went to the ground. And I was like, oh my God. I was like that was the best.
What was second position?
Ever. And well, no, it hadn't happened yet.
No, okay, but what was second position? Because we were standing. Because
we're still standing.
I'm standing. Now we're on the floor.
So now I'm on the floor and I'm on my knees and I'm like, oh my God, but it hadn't happened yet. So then I go to the tub and I lay in the tub because I'm like, I don't want to clean this up like later. Or like, I don't know. It made sense for me to go in the tub because it was right there. And so I got in the tub and
standing again.
I'm standing again because I wanted to feel the wobbliness.
Okay. You wanted to wobble again.
Then I knew it was working. So then I started wobbling and I came, and I knew I came because I had squirted.
Amazing.
I was like, this is the moment I've been waiting for. And I was like, and I, at first, like, if I didn't also, again, going back to the podcast, if I hadn't listened to the podcast, I wouldn't have known that I had squirted. Like, I probably would have thought it was pee or a problem. But it definitely was not. I was like, and it felt like the wave. I had finally ridden it to the shore, and I was like, yes, like I like hadn't hit a wall. It was perfect. And then I like got back in bed and I was like, but what if I didn't come? I like started second guessing myself.
You were gaslighting yourself.
Exactly. I was like, but what if that wasn't it? And so I was like, I better do it again just to be safe. Yeah. And I did it again. And I was like, oh my God, yes.
Unreal.
And so it happened for me in like the span of 5 minutes for the first time.
Oh my God. Congratulations.
Yes. Thank you.
And how old were you when that occurred?
24.
24. Crushed it.
And now I come during sex too.
What?
Nice.
Yeah.
How?
After my birthday. I know. Inside man and outside man. Like Unreal. I have to do. Yeah.
I love that you like use so much terminology. Like you're saying things that I'm like, I said this 5 years ago, but now I'm remembering that I said them. I'm like, Robin, put this on merch.
Put inside man on merch. Honestly, we might have
I've
to.
I've listened to your podcast maybe like 2 times over, but then there's certain episodes that I listened to. I've listened to the 2 Christians episode maybe like 30 times.
Yeah.
I showed it to my roommate. I actually told my grandma last night that I masturbate. It was not for a good reason. She's super religious. She just started talking about like being gay and like, you know, what the Bible thinks about it. And then she was like, you know, like lesbians, like they need to, and she only speaks Spanish. So I have to like ask for what things mean. Like I have to ask her sometimes. So she like said like sex toys, but it's not the word toys, juguete in Spanish. She said something else. But I was like, what is that? She was like, lesbians have to use this. And I was like, what are you saying? And then she was like, toys. And I was like, I figured out she meant toys. And I was like, oh, who get this? But it doesn't translate like the same in Spanish. Like she just laughed because toys. And then I was like, well, I use those. And she was like, what? And then
that is for a good reason. Honestly, when you said it wasn't for any good reason, I believed you, and you're wrong. Because that's really nice, because not only are you like normalizing toys, but you're normalizing sex of like women, like gay women. And like I also would say, after touring with Ashley and hearing her jokes over and over and over again, not all lesbians use toys. She said she never has never, you know, like, that seems to blow people's minds. But like, yes, I love that you brought that up to your grandma.
She was like taken aback, and she was like, well, what about Zach? And I was like, oh, no, it's just for me. Like, and she was like, oh, and then she was like, so like masturbation. And I was like, because again, it doesn't translate the same. And so like, she was like, you masturbate. And I was like, yeah. And she was like, well, women aren't supposed to do that. The Bible says that's a sin. And I was like, well, what about men? And she was like, yeah, them too, they can't, and they shouldn't. And I was like, I'm not going to win with you. But I was like, I'm a sinner. Like, I'm not perfect. And she was like, I know. It was a really good conversation.
Make her listen to two Christians.
She doesn't speak. I mean, I'll have to translate the whole entire thing for her.
We'll get Roxana to do it.
Yeah, we can do that. Roxana's got more work coming her way.
We've got two women in Mexico that could do this. We could do Nina. We could do Roxana.
It'd be perfect.
Actually, you know what I wanted to tell you, because you brought up your grandmother and you know the podcast so well. I actually had a dream that Nanny came over and visited me last night, and it was like
in LA or Portland.
I have no idea where we were, but it was like we went to dinner, and it was like just the two of us, and we had like the best little girl chat. I don't like remember what it was, but it was like such good vibes, and I woke up being like, Nan! Like I was just like so happy. She's around,
honestly,
she's around.
When you lost Nan, that was a really sad day. Like me and Zach, my boyfriend, we were like sending, like, I think he saw it on your story first, and he sent it to me, and I was like, today's a hard day. Like, I'm sorry. I'm sorry.
No, I really appreciate that. That like, I'm so happy she got to like touch more people, because she was so special.
Yeah, she was.
It was great.
But now, from grandmas back to orgasms. You have more congratulations, right? Is that what, Rob, you said that there's multiple, or it was just coming from, I mean, not just.
She just, in the summary, was since then I've been able to orgasm in other ways. So internally.
Okay. So you can do it in any position now with him?
I don't know if anyone else is like does this, but I'm really fucking lazy. Okay. So he lays on his back, and then I lay on him on my back.
I love that
thing. Wait, does he have the biggest dick ever?
Like it's the only dick I've been with.
But like, it sounds huge.
It sounds decent.
It's pretty big. We met at church camp.
Amazing.
And so we were interns. I lived in the girls' house. He lived in the guys' house. So all of his roommates are like my close friends, and they would like all tell me like, he's got a big dick. like I was like, okay,
so.
Like, sure. Like I think it's nice, but I have nothing to compare it to.
Cool. This was awesome. That wave metaphor was like so awesome, and I think will like resonate with so many people, like bringing back like how harshly pussy hit your ear, and like now the fact that you can like hear it and say it, like these are very important things, and I feel like sometimes I forget about them because like it has been such a long time. And so like if anybody's listening to the podcast right now and like you're early in the journey, like don't even worry about it. Look how far we've come. Look at Natalie.
I know. insane.
It's
I know,
nostalgic
it's
thing to
crazy.
think about of season 1 Remy and where she was, and I think it's like the same exact sort of story, but just like Natalie's.
We have twin comes, except for I didn't get in the shower, but that's because I didn't have a tub. If I had a tub, I would have gotten in the tub.
Yeah,
you should have had a tub.
Yeah, no, but I think about that first come too. That like I'm like after standing upright, I went doggy style. Like that was my inclination. Like now I haven't masturbated doggy style in months. I'm always on my back now.
Yeah,
I love how that was instinctively how you dropped.
And when you guys have sex, do you need the toy on you too, or no?
No,
Unreal.
Yeah.
Okay, we have less than a minute left, so let me ask you, Natalie. Thank you so much for being here. I do have to ask you this question. Did you finish?
I fucking finished.
Yeah, bitch. Thank you so much for coming.
Did you finish?
I did! Thank you so much for asking me.
No problem.
Thank you, Natalie.
Bye.
Oh my God. I love Natalie. I love Natalie's boyfriend. Shout out to Natalie's boyfriend. We love a boyfriend who listens to a podcast and then buys a sex toy that we recommend and then makes his girlfriend have her first orgasm ever. Are you kidding? That's amazing. Shout out to you, Natalie's boyfriend. Also, friends that get their friends sex toys. Very nice. People helping people, we love to see it. If you're looking for an amazing sex toy, look no further than Dame Products. I am obsessed with this company. It is vulva-led, vulva-owned, all vulva-tested people who have gynies, making stuff for gynies and doing it right. Satisfaction guaranteed every time. You guys need to check out Dame Products if you haven't already. I love Dame's toys and I love their mission, which is to close the pleasure gap. And they're making the world a happier place, one vagina, one vulva at a time. They have a new air pulse arouser right now. It's called Air. I haven't tried it yet, but it's supposed to be amazing. Can't wait for it to come. I have tried the Arc. I really like the Arc. It is a G-spot vibrator. It's good for penetration. It helps you discover your perfect spot. And also there's a pillow. It's a sex pillow. It's spelled P-I-L-O. But like if you want extra insertion, your hips propped up, there's a pillow. It's amazing. They think of everything. Also, the Eva 2, I always have to give a shout out to. No hands, no hassle of holding a toy in place. If you are a vibration person and you like something to vibrate over your clit while you are being stimulated or penetrated, maybe with the Arc, who knows? You can do that, and it only takes a finger to keep it in place. I think that these toys are so great, and I think that you guys will have a great time using them. And when you do, I don't want to say if you do, when you do, please DM me about your congratulations because we love to hear it. With Dame, your satisfaction is literally guaranteed. For 15% off your first order, go to dameproducts.com/howcome. Again, that is Dame, D-A-M-E, products.com/howcome. These toys are amazing. Okay, I am so excited. We are talking about SSRIs and how they affect our sex life. Welcome, Dr. Bartlik.
Thank you, Remy, for inviting me.
Of course. Also, welcome, Andrew Collin.
Thank you for having me.
This is so exciting.
Is this my doctor?
Yeah. This is our doctor. This is How Comes Doctor.
Yeah, it is funny when there's also a therapist on. I feel like I owe her money at the end of this.
Yeah.
Yeah.
We actually tried to have you on once, and then that recording got corrupted.
Well, I'm very happy you gave me another chance.
I'm so happy. I thought we could get into your story first of how you started working in psychiatry and sex therapy and what that journey was like.
Well, I'm a medical doctor first. I happen to have been taught by some real leaders in the field at my medical school, and then at NYU, where I did my psychiatric residency, and then at Cornell, where I'm on the faculty. So I had great teachers, great exposure to sex therapy. And let's face it, it's a very interesting area. You hear great stories all day long from your patients.
Yeah.
Really, really interesting. I would say the most interesting part of medicine. So, that's how I got started. I've been in practice for over 35 years and in Manhattan in private practice. And, I treat all sorts of problems, all sorts of psychiatric and medical problems like depression, anxiety, but also things like fibromyalgia, chronic fatigue, things that are really more physical.
When you were getting into sex therapy, was there like excitement around it, or was there judgment maybe from parents or friends?
Well, what could I say? It was mostly interest. There was interest around it. I got people always wanted to talk about it, and wanted to hear what my work was like. I mean, you just there was
tell you way too much about their lives.
Yeah. One downside of it is that when you identify yourself as a sex therapist, which I am, it cuts down the referrals for other
regular
problems.
Yeah, or not regular problems, like other problems. Yeah.
I enjoy treating, garden variety, depression, anxiety, other mainstream things. You become a specialist, and that cuts down your scope. And that sometimes that's not so fun. And that is something that I struggle with because I like to do both.
Yeah, I have depression. I have anxiety. It's never been coupled with sex issues from the meds, I don't think. Andrew, you've had side effects from meds before, right?
Yeah, I didn't start taking, I had ADD when I was younger, and I was given Ritalin at a young age, and I never would take it. I would just put it in my pocket and then give it to hot girls. I don't know if
what?
Yeah, I would just give
like girls, a penguin with a pebble.
Dude, girls would chase me around. So, that was something I was diagnosed as a young age of having ADD, but I never really took care of it or looked into it. I went to college. I would skip class. I would cheat on everything because I couldn't sit in class, and my brain would race. Drinking didn't help. The next day I'd be hungover and my brain would race even more. Depression would lay in. So all of this went on throughout my 20s and really, and I didn't realize that I had an anxiety disorder. And so essentially, I was really hesitant about getting therapy, the idea that it's weak, I could throw a football. Way more people have way worse problems than me.
Yeah.
It's too expensive. That's what a lie that is told a lot, that unless you look into it, that's what you think. You think that it's not affordable. I got on Lexapro at first, and that really messed my stomach up, actually, and my butt. But we don't need to get into my butt.
I'd love to get into your butt.
Oh, we could get in there if you want. At like 37 or 38, I finally found Zoloft, and my mind has stopped racing so much. I mean, it's been a godsend for me. It really has.
That's so nice. It's interesting that you said that you didn't like Lexapro, because Lexapro is like a godsend to me. Like, I feel like the second I got on it, like I've said this on the podcast before, but like I was so depressed, so anxious. And my psychiatrist at the time was like, you're like trying to climb Everest with like ankle weights on, like, because I refused to take my meds. And she was like, just like take the ankle weights off. And like the day I took the Lexapro, like I felt like the ankle weights like really came up. Like I was like immediately like spiraling less, and like kind of felt like, I can breathe again, So like I know that I'm like quote unquote textbook Lexapro, like where like it like really, really helped me, and I really, really loved it. And your response was different than that?
Well, it just really messed my stomach up. Like my stomach was killing me, and I was using the restroom way too much. Like it was bad. And so then, when that happens the first time, you're like, all right, well, maybe this isn't for me. And they're like, well, Zoloft tends to have less side effects, but the one side effect is not being able to have an orgasm. Which, can, lead to other kind of anxiety and other kind of depression if that's not happening. When you ask like the side effects, that's just the one that I'm kind of finding that I run into, is not being able to have an orgasm. And like I could have like one every like 4 days. Like So I won't masturbate. I'll save it for the girl I'm hooking up with.
Yeah.
Because I'm a gentleman,
Yeah.
And
you got to store those cums.
Yeah, you got to stock up.
Stock up your cock up.
So I do that, but it's usually just one time I can have an orgasm. I can never go a twofer. And the one silver lining that I've found from this is that I'm more focused on her orgasm because I've kind of given up on my own. So I've at least find positives in it and I could be more in tune with her where it's not just about me getting to climax. And I think that that wouldn't happen necessarily if I was just having an orgasm within the first, 7 minutes. Mm-hmm. I'm not trying to brag by any means, but the fact that I can last so long, I can really focus on her.
Yeah, you've really hit on an important point here. It does take longer. And for some men, it takes so long that it's uncomfortable or, embarrassing. And they call that retarded ejaculation. And other men have premature ejaculation. And these SSRI medications are a good treatment for premature ejaculation. Okay, because those guys need to be slowed down.
Yeah.
Interesting. I think I never really had that much of an issue of coming too quick, but I would lose my heart on. That was another thing because I was drinking a lot. I stopped drinking about 2.5 years ago.
Congrats.
And just the of not doing well, whatever, that shit going on in my head, that Zoloft has quieted. But so then now I'll take Viagra. 20 milligrams. I don't even care. It's I don't even, in me, my 20s, I'd be like, I take Viagra. Don't tell anyone or I'll kill you.
Yeah.
I'll kill your whole family. You tell anyone. But now I'm I'll take it in front of the girl. I'll be like, look, I want to be as hard as I can for you for as long as I can. Whatever. Don't look at it as being weak. So much about medicine is weakness. That's what we think, at least my generation. I'm 40, but
in my family, we thought coffee was weak and Advil was weak. I've done nose jobs without pain medication. How often are you seeing people with depression coupled with sex issues?
It's very common. Sexual dysfunction occurs in about 35% of people with depression. So, it's very common. So if you're depressed, you often have sexual dysfunction. Then you go on medication to help your depression. And almost all of them cause sexual dysfunction. So you have sexual dysfunction on top of that. But a lot of people who are, very attuned to their sexuality, they know what their rhythms are like, how long it takes to do what, to get to what level. They can tell the difference immediately when they start an SSRI medication. Between 25 and 75% of the patients on SSRIs have sexual dysfunction. Okay, depending on how you phrase the research question. If you have a more refined study that gets at real detailed information, that could be 75%. If you have a very simple question, can you achieve orgasm? And a lot of people say, yes, I can. But
Andrew would say but it's every 4 days I have to stock my cock.
Right,
I got to stock the cock, doc.
Right. Or it might take 2 or 3 times as long. You're not going to pick up the subtlety. So that's why the numbers vary so much in the research. So it could be 25 to 75%, but that's a high percent. Sexual dysfunction happens to be the most common side effect of the SSRI medications.
It's so crazy.
I do a lot of nutritional supplements in my therapy. I would rather give a patient a nutritional supplement that would help their symptoms of depression or anxiety or sexual dysfunction than give a prescription medicine that is likely to have some pretty serious side effects. So I'm always trying to find natural ways to heal these problems.
What is it, the part of your brain that makes you happier also makes you not be able to come? Why are those connected? You would think, Wellbutrin apparently helps your sex drive, I've heard, or you mix them with Zoloft.
That's the one that everyone's been
that I've been telling people with my no fucking education, but like everyone who has had this problem was like, well, then I switched to Wellbutrin and it was fine, or like something with Wellbutrin.
Well, you see, Wellbutrin augments dopamine and norepinephrine in the brain. And dopamine is the most sexual of the neurotransmitters. So that's helping you in the sexual area. So actually, when they first start Wellbutrin, a lot of people feel the little extra surge of dopamine and they feel a little extra sexual. And that may go on for several months. But once you've been on it for several years, you can lose that. And it could even cause some sexual dysfunction, but nowhere near as much of this as the serotonin ones. You see, serotonin makes your mood feel good, but it also reduces
lowers
your level
libido.
It lowers dopamine and norepinephrine. So they're on a seesaw. When serotonin is high, the other is low. So that's
sad.
why. So it's really good if you can manage it. If you need an SSRI, take the SSRI. If you have sexual dysfunction, add the Wellbutrin. And take like half the strength of each so you can balance out the sexual side effects.
I'm sure everybody has like a different cocktail too. And that's why it's like important to go to a doctor and have like it managed by them.
Right. Yeah. As Andrew told us, Viagra and those medications are very helpful for this problem. And women even use it. Of course, it's not intended for women, so insurance companies won't pay for it. But there are studies that show that Viagra helps women with SSRI-induced sexual dysfunction.
Cool.
And then there are a few other new medicines.
The clitoris grows to about 4 inches, I've heard. What? No, when a woman takes Viagra, her clitoris, whatever.
No.
Yeah.
No. But it does improve the blood flow. A woman has as much erectile tissue in her vaginal area as a man does, only it's configured differently. But there's just about the same amount once you correct for body weight. So women have the same tissue that responds to Viagra with engorgement. So it does work in women. It's just that women are a little more tricky to study. So when they went about to study it in women, they didn't get such great results and they pulled the plug on the study before it was finished. But it really does work in women. If they had tried a little harder, I think they would have shown it. But what's
tough for me is if I'm not having an orgasm, which a guy, like when a guy doesn't have an orgasm, the woman's like, well, what am I doing wrong? Because it's so understood that a guy should come. Like, it's just like in our,
that's been like the marker to like, how many times did you have sex? It was like, well, how many times did he come?
Yeah. So the idea of me not coming, so then the woman will go, well, what's wrong with me? Is something wrong with me? And I'm like, I have to tell her, it is you. No. I'm kidding. No, that's what I do every time. So it makes me sometimes not as sexual because the outcome is her being upset that I'm not having an orgasm. So it doesn't just affect me, it affects the partner I'm with, which is tough because then it'll make me.
Okay, we're all still here except for Andrew. It's fine. He'll be back. But that reminds me of like Ian Kerner. He wrote an entire book because he was like a premature ejaculator and then had to shift focus to the other person and made it not about like, well, why can't I? It's like, let's focus on you.
Yeah, well, a lot of men with sexual problems end up being better lovers because of that, because they are focusing on the partner.
Yeah.
And then, of course, once the pressure is off the man because he's focusing on her, then he's more likely to get his second wind. He will, revive. And
especially if there's less judgment, like I can imagine it being like incredibly stressful. Like you're naked. Like when I wasn't coming, at least there was no physical sign. It didn't inhibit the rest of the sexual endeavor. Like if my clit wasn't hard, like if a guy is not able to get hard or stay hard or whatever, like it could really take the wind out of his sails and her sails, like what he was just saying. And then if she responds in a way that's like judgmental or like critical or like angry and like
or
sensitive
hurt.
Or hurt, like then that becomes the emotion in the room of like there's something wrong in our relationship.
Yeah.
It's okay.
I'm so sorry. That never happens with whatever. That never happens.
That never happens. It's us.
It's all three of you women.
Well, Andrew.
Yeah.
I want to ask you. So when it happens that you can't finish when you're with a woman, do you ever just go to sleep and wait till the next morning to try again?
Yeah, that's happened. It just gets frustrating if, like, let's say I do that and then the next morning it doesn't happen again. But, if I have sex with someone multiple times, they kind of get it, eventually that, like, oh, neither one of us is going to have an orgasm. No. No, but like the understanding, like, I'm really enjoying this. Yeah. Obviously I'm enjoying it. I'm hard as a rock, as doctors say. But like, I'm everything shows that I'm into this except for the climax part. Okay. And, but it is tough. So what I'll do sometimes is I'll take maybe 2 days off from the medicine.
Yes.
If I know I have a date coming up, which I was told to do by my doctor. The only problem with that is by the third day, my anxiety and depression start. So it's like an episode of 24 or something, like where like I gotta come before my anxiety comes back.
Before I start crying.
Yeah. So
please let little head cry before big head cries.
Well, yeah. I mean, the problem is I think you forget how bad the anxiety and depression was. Mm-hmm. So you're like, oh, I can't come, boo-hoo. Like the medicine, fuck this medicine. And you get mad at the medicine, but then you're like, oh no, the anxiety and depression was way worse than this 2 minutes of uncomfortableness with you and a partner. You know what I mean?
Right.
So at least that's what I tell myself. Will I start putting lower dosage maybe later if I'm trying to have a baby or something? I don't know.
When you're with someone new, do you ever warn her that that you're on medication and this might happen and it's not you, it's just a function of my medication, but I know how to cope with it. I have all these different mechanisms of coping. And do you ever let her know that in advance?
If I think it's going to happen again, a lot of times, actually, the first time I hook up with the woman, I actually have an orgasm easier. I don't know what's going on there.
Because of the excitement, I think.
Yeah.
Like, right?
Yeah,
like you're so wrapped up in like the like, fuck yes. Like this is happening.
Yeah, and it's new. I don't know. It's but then there's another thing where this is going to be kind of weird, but I think I've told Remy this before, but the only way I can orgasm a lot of times is with my own hand when I'm, and it's got to be exactly how I like to jerk off. Like, I don't know if it does something to my brain. So like, I like a dry hand job.
Yes.
I'm not really a lotion guy.
Yep.
So, I joke that I want the woman to be as dry as possible, but that's not true. But like, I'll end up actually having a better orgasm when I wear a condom than when I don't wear a condom because it's drier and the friction is harder. I don't know.
I'm sure like, this is sounding very attractive to a lot of women. They're like, I always get to wear a condom. There's going to be no pushback with that. Like, love it. Don't have to have lotion around. Can do a handy anyway. He'll be doing the handy. I just have to be there and love him. That sounds great.
Well, a lot of women.
Want.
A lot of women like to watch. There's nothing more sexy than male masturbation for women. I think it's in the top 5 women's sexual fantasies. So it's like, she gets a show.
You know what I've been doing that I think helps everybody? I'll just have her sit on my face, like ride my head while I jerk off behind her back.
Ooh.
Which has been working out for everyone,
Yeah.
And my shrink told me to do that, so it's cool.
Wait, so she's facing this way. Oh, this is amazing position. Okay, great. I'm gonna draw it for you guys on Instagram.
Yeah. She's sitting on my face, holding the headboard, and then I'm doing a reach around her.
Yeah.
And jerking off.
And if she wants to look back at it, she can.
Yeah. Or hold up a knife or something, like a mirror of some sort. Yeah.
Knife?
Well, Like this. I don't know why I have I always have a knife on me, Remy.
Or like if she's wearing like those cool like spy glasses that have like the little mirror in the side.
Yeah.
She could like look back at it.
But yeah, I don't know. So I just try to figure it out, and I try not to overthink it.
Right.
At the end of the day.
That's the other thing that people should do when they have this problem, when they're on medication, is get some sort of counseling, which you have. And it sounds like your psychiatrist is really good at advising you on all the tricks of the trade. So get some sex therapy. So you might consult an expert if you're on SSRIs and having sexual problems. There's so many things you can do. Like for women, there's even a new medication, somewhat new, called Addy, which is a pill you take every day, and it increases sexual desire, and it has nice effects on arousal and orgasm. So that might help. And then there's another one called Vyleesi, which is a hormone type of medicine that you inject only 45 minutes before each encounter. And that one has very strong sexual effects.
Cool.
And then the men, in addition to all the Viagra-like medicines, they can take testosterone. Women can also take testosterone. So all of these things you can do, but you need the help of a doctor.
Of a doctor who's like monitoring it and figuring it out with you.
Yeah.
Do you think I should explore Wellbutrin and talk? Because I need to get a new shrink here in St. Louis, but...
Well, Wellbutrin is a great medicine for depression. It's very nice to add a low dose of Wellbutrin and then reduce your SSRI dosage. And that's a good thing. Some people are very anxious and kind of revved up, and they can't tolerate Wellbutrin. I mean, that's a very common situation where they just go really anxious when they have Wellbutrin. So they can't, that's not an option for them. But, I think the best thing for you, Andrew, would be to take some B vitamins. The SSRI medicines are known to deplete the B vitamins. And so you should, especially like methylated B vitamins, the high quality B vitamins that you would get online or in a health food store, not just what you get in the drugstore. So so in other words, your medicine is depleting B vitamins. So why don't you put them back?
Okay.
Yeah.
Okay. Another thing you can do is take some vitamin D. Vitamin D raises testosterone, improves sexual function in men. Okay. Vitamin D is necessary for making dopamine. And so you want a little boost, take some vitamin D. Also take some magnesium. Magnesium opens your blood vessels, enhances nitric oxide production, which is this gas that keeps your blood flowing, and it improves erection. So take magnesium. And a lot of people are deficient in magnesium, vitamin D, and also in B vitamins. Are you on any other medications besides the SSRI?
No, just that, just the Zoloft.
Yeah. And then
I'm on 50 milligrams too, which isn't even that much, I believe.
Right. That's a smallish size dose. It's like a starting dose. And then there are all the herbal medicines like tribulus and chrysin. You could take all these things to help boost your testosterone. And, paleo diet. Okay. Give up the carbs. Carbs are anti-sexual. Give up the drinking. The drinking makes you pour out magnesium from your body. Anybody who drinks on a regular basis is going to be magnesium deficient.
Wow.
So there are natural things you can do too.
Yeah.
We had this list. I think we've already covered most of them. It was meeting with a therapist, adding a drug, switching to a different drug, taking a drug holiday, also scheduling sex because of when in the day you take your pill and when it might be effective.
Yeah. When is the best time to take a pill if you want to come at night?
Probably the night before. There's a 24-hour half-life. So, take it the night before, then the next night have sex, then take your pill right after.
Gotcha.
And I was wondering, how quickly are patients seeing that it's affecting their sex lives? How quickly will you know maybe I should switch it up or make it a cocktail or something?
Well, when I see my patients and put them on the SSRI medicines, and they come back to see me usually in about a month, they know by then. They know by then. And I think within a week or two, they know. And, although they can be confused, like one person said, well, I don't think I love my lover anymore. I think I'm falling out of love because I haven't been able to have an orgasm. And I had to explain, oh no, that's your medication.
Yeah.
And he's cheating. I do think like what Zoloft does do, it sounds so cheesy, but I think it really does make me better in bed because my anxiousness is gone, so I could be more present, and I can like, I don't know, it's weird. Like I used to have sex, and I'd be so in my head that I couldn't even take in her body or take. It's
like airplane mode for sex.
Yeah, that's kind of how I was. And I would just go until I get off the plane. And I was like, was that a good ride? Was there turbulence? I don't even know. You know?
I'm saying like when you turn off all your apps or whatever on airplane mode and you don't get the notifications and stuff.
Oh, I thought you meant like airplane, like okay, yeah. So anyways, long analogies are fun. Yeah. No, but like I can really take in her body and like take her in. And that's like, a great thing with SSRIs is that it allows you to be present way more than I was before. So I don't know. I'm just trying to find what are all the positives outside coming essentially,
Oh my God, not being sad. Like I might not be able to leave the house if not for the SSRIs.
But yeah,
I do think that it's important not to stay on these things for your whole adult life. I mean, you should have periods of time where you come off this medication and do some natural things to help yourself fight depression.
Can we talk about that, about how slowly you should wean off if, let's say, you're taking 50 milligrams a day and, you're jerking off behind a girl's back, like when she sits on your face, like how do you weed off from that?
Right. Well, I would tell my patients, cut the 50 milligram pill in half, take half a pill a day, and leave it at that for a few weeks, and then cut that half in half. So you're taking a quarter of a pill a day and see how you feel. And that's how I would gradually wean someone off. If they got headachy, felt disoriented, that might be a withdrawal effect. And I would just tell them, slow it down and go back to a higher dose, maybe go back to 3/4 of a pill and see if you can get over those side effects. And then in a few weeks, try to take it down to a half again. So it's a very personal thing. You go as quickly as you can, come off it. Now, there are many things to do to fight depression naturally. Do you know that exercise is as effective as Prozac in fighting depression?
That's wild.
Yes, that's been studied. Things like omega-3, probiotics, B vitamins, zinc. Okay, there are many things that you can take. Even vitamin C is very helpful. Curcumin, which fights inflammation. So there are just so many things you could do to help depression. You could even take the precursors of serotonin, which are tryptophan and 5-HTP, as a natural antidepressant, over the counter, no prescription needed. So you can do natural treatment for your depression.
It's so funny, or it's not funny, but it's like wild that like exercising and eating well have been so aligned with just like looking good culture and not feeling good culture. And like I've always been really resistant to those things and vitamins and stuff. I'm like, health, like no, because then like it feels like a struggle of an unattainable thing that you could look like, but like exercise to feel good like is real. Endorphins are real. And
sugar,
eating well and sugar.
Eating sugar and junk food, it impairs your brain in so many ways. Okay, there's a regular roller coaster of insulin and glucose that's very, very bad for the brain, can really make a person have mood swings, depressive episodes. And also trans fat is in every processed food. Trans fat, even though it says 0 trans fat, what that means is that there's a small amount of trans fat in there most likely, but it's below the level that the government requires them to report. So you have to look for the word hydrogenated or partially hydrogenated. If it has that on there, and that's all your chips and crackers and fried foods, you've got to get all that out of you because it disrupts your cell membranes. Okay, and that affects your brain.
And I think I just feel like, when you have like a list of like all these things that you have to do to feel better, right? It could get overwhelming. And then if you don't do it, you could be very hard on yourself.
Totally.
Because you didn't accomplish, you didn't work out that day and you didn't drink enough water. And next thing you know, you're like, oh, I'm a failure. And then that starts a whole nother thing. So I think you can ease into these kind of things too. And like maybe give like a starter kit to people listening, here's 3 vitamins. Here's 3 workouts a week, and be easy on yourself. Cause I think that's like the hardest thing for me.
Or just start adding one workout a week, or just starting adding one vitamin, like the way that we were saying, like it doesn't need to be like a big overhaul of your whole life, like fucking self-improvement montage. It can just be like little additions, like every so often, and then like give yourself a little pat on the back for those additions.
For sure.
Yes.
But Dr. Bartlik, I know we have to let you go because there are other people who need your attention. Can you tell everybody where they can find you online maybe? Or
Sure.
Yeah.
My website is drbarbara.md.com. That's DRBARBARAMD.com. drbarbara.md.com.
Okay, perfect. And I have to ask this question to everybody on this podcast because, we're having sexual experiences. You got to ask the question. Dr. Barbara, did you finish?
Yes, I do finish.
Okay, great. Did you?
Almost every time. Yeah.
Okay.
All right, let's not rub it in.
Okay.
Thank you so much for coming.
Okay. All right. Thank you, Remy, for having me. It was a pleasure.
Of course.
Anytime.
Great meeting you.
Nice to meet you, Andrew and Robin.
Thank you for the help.
Oh, my pleasure.
When I'm back in New York, I'll look you up.
Oh, please
Yay.
do.
Oh my God, that would be so cute. Okay, now Andrew, we can really get gross. No.
Oh yeah.
Yeah.
So I was fucking this girl in the ass last night.
Yeah, but like what happened with your butt with the Lexapro?
I just shit so much. I was like crying. It was hurting my butt because I already had butt problems before that. My asshole's a real mess. A real mess. It's a mess. It's my great grandma had a bad asshole. Her great grandma.
Honestly, we're learning that it's genetic.
Dude, so much of it really is diet for me, at least. Like my thing is like my asshole that hurts when I eat the wrong foods keeps me healthy because like in a way, like I'm, you know what I mean? Like,
yes, your body is a system.
Yeah, my body's very sensitive. I don't know if it's because I'm Jewish or what. Like I maybe because of my emotions, because of the Zoloft, I'm better dealing with that anxiety than now just physical shit hurts more. I don't know. It's
no, but your body knows what you're going to listen to. You know what I mean? Like they're like, like we want to be more healthy.
Yeah.
Andrew, if we give him a headache, like, nah, he's not going to pay attention. Make him shit.
Let's sting his asshole with wasp. Yeah. Yeah. Let's throw some bees in his butt. That will get him. Yes. Anyways,
bees in the trap. Bees in the trap. Yeah, no. So before the butthole problems, before the depression and the anxiety and all that, can we go back to a time, a young Andrew? He was first discovering his sexual side.
Oh man.
Do you remember your first cum or first comes?
I remember my first pre-coms that I thought were comes.
Ooh.
But I was in a hot tub, so I didn't know if there was cum coming out. The bubbles really were heavy in there. It was hard. I was like 10 or 11, and my parents had a jacuzzi bathtub in their bathroom. Not to brag.
Yeah. Oh yeah. You told me this on the live show.
Yeah. And so
Hilarious.
I would fuck the jets like every night for like 2 hours. This is probably why I can't come now. Like I mean, it was insane. And I would bring a book in.
No one will ever measure up.
Yeah. Look, there's 6 of them in there.
Yeah.
You know, you gonna find a woman with 6 pussies? I don't think so. But anyway, and different speeds I could control. Anyways, I would go in there and I'd bring a book in every night and I'd pretend to read. And I couldn't even, I knew like 9 words at the time. And I think I knew less by the end of that year because I was just fucking, you know, I probably could have read and fucked at least 3 pages, but nah, that book just sat there. And I think my mom, no one ever figured it out. I joked that my mom figured it out when I got an F in English, but she's like, but he's reading Ulysses as a 10-year-old. I'm like, no, Mom, I can't even read fucking that Bearstein Bears, you know?
Yeah, no, I'm fucking your tub. The F is for fucking your tub.
Maybe that's what caused my parents' divorce, you know?
No.
Maybe. You never know. So anyways.
She wouldn't let him use the tub. She was like, stop cheating on me with the tub.
Andrew's always in there. Yeah, she got the tub in the divorce. We got the tub, if you know what I mean. So that was kind of my first where I really remember being sexual. I remember I got a nudie magazine, I remember, and I remember like, oh man, it was like really close in like shots of the vagina, like really.
Oh, okay.
And I would literally put my penis
on like top of it.
Yeah, I'd get paper cuts all day long. And like just like I should have cut a hole in it and inserted and then put something else like the dog's mouth behind it or something. I don't know, something weird.
Something warm. The hot tub.
It's too much water. You know that.
It would gush through, yeah. You need to get like a fat head.
A fat pussy just for my wall.
For the drain.
Dude, they should make fat pussies. That's so smart.
Honestly, they should.
So I was like, I don't remember the first time, like, because like when a guy will jerk off, a little pre-cum will come out for a while until there's the full-on explosion. But I didn't hit puberty till real late. So you would think I'd remember because I didn't, you know, because I was probably a little older than most kids when I first had an orgasm. But I can't really. No,
you were having orgasms. You just weren't having full splooges.
Yes.
Right?
Yes.
You were having feelings and bursts.
Oh my God. The feeling was, I think, better than my orgasms now. Like, it was insane. And it lasted a while. Like,
that's what
you throw
we
your
do.
Yeah, you throw your dick on a jet, like I don't know. Yeah, dude, it was wild. I was
when you're
edging,
a jet, you're a jet all the way. New West Side Story coming out soon.
You'll need a cigarette if you know what I mean, because you're fucking them. Okay. No, but yeah. So I was kind of weird sexually, though. I was a virgin throughout high school. I was prom king, but also a virgin, which is so sad.
Oh my God.
Yeah.
You're like Colton Underwood. The virgin bachelor.
Yeah, what's the point of being the king if you're not fucking? It's really pathetic. And then I went to college.
Cool, though. It means like people really like your personality. You know? They're just not just voting on that big old hog.
Yeah, if I fucked in high school, there's no way I would have won.
See, that was your body saving you. They were like, we really want to win prom king, okay? Don't fuck yet.
I mean, fast forward. That's why I don't sleep with Nikki. It will only,
That's
it would
why
only ruin the career.
She won't let you.
Oh yeah, that too. But my point being
Nikki
is, like,
in here.
I'm not fucking for career advances, is what I'm saying. So then I went to college, and the first time I had sex, I was just hammered at like a sorority formal, and the girl gave me $80. I remember.
What?
Yeah, like I was like a prostitute the first time I fucked, and she gave me $80 and just to get drunk. She had like a bunch of money, and I got hammered. I didn't even talk to her, and then at the end of the night I was so drunk we went back to her dorm because like in my mind my parents were divorced. I was like, first person I make love to I'm gonna marry. Like I had that whole thought, and I just fucked her terribly, like with a mush penis. and then she asked for like $80. She asked for the money back, I think.
No.
No. She's like, can you give me 100 back? because I think you owe me 20. But so that was my first experience sex. And then like, I really didn't have sex again until like my first girlfriend in college. And we had a decent amount of sex. Mm-hmm. But she hated me, I think. But yeah, so sexually, I was always kind of weird for a long time. I just wasn't my best self. Like looking back at it, it's so funny. Like for like 10 to 15 years, I was like, I can't believe she never fucking loved me. And then like within the last 5 years, I was like, oh, I don't think I showered that much. You know, like I don't think, like I really wasn't the best I could be at that time. And I don't blame her at all anymore.
Also true. Also true. That being said, I don't shower a ton now, but I think I've done self-improvement in other ways that make me more bearable. And self-reflection is a real thing when you look back and you're like, it wasn't always them.
What do? You just put things around you that smell worse? So you smell better?
I tend to smell bad. Like, I don't think I start smelling bad until like day like 4 because I don't do a lot of physical activity. I'm not doing like a lot of sweating. You know?
Don't you get anxious when you just sit around so much?
Sure. Sure.
But yeah, no, things are good. I've been seeing a girl here. That's who I keep talking about. We haven't had the official talk.
Okay.
You know, but on both ends. But yeah, I mean, we definitely hang out a lot. And I'm really turned on by her. And like, she's so fun and silly.
I love it.
Yeah. Yeah. It's pretty cool. It's
really
cool.
nice.
Like, and she gives me like a lot of compliments and stuff. Like I don't think girls know to give guys
we
a lot of
talked
compliments.
about this before. Yeah. Like only Matthew Camp said this to me. Girls don't realize that like guys need to be gassed up, like, and like need compliments and stuff because like they just assume it. And like apparently like bi girls are more likely to give boys compliments. Like I've always complimented my boyfriends.
Interesting.
Like I've always been like, you're gorgeous. And like, I love your butt. Like, is she always doing that type of shit? Or like,
yeah. Or like I'll self-deprecate, you know, and she'll be like the other day she left her bra here and I wrote her and I was like, hey, just wanted to let you know, I picked it up and smelled your bra and it smelled fantastic. And then I even put it on and she goes, how did it fit? I go, a little snug because of my, you know, my fat back. And she goes, you mean your muscular back? And I was like, But then, dude, I've messed up though, calling her like, dude, I called her my little bodybuilder and she fucking hated that, boy.
Honestly, a guy told me that I had a nice back once and I've never forgotten it. I'm like, in what way? In what way? Like in a guy way?
Like you look too much like a powerful swimmer.
Yeah.
Yeah, I get that. A girl's back, you really sometimes forget how incredible it is, you know?
But also, if you were saying a little muscular bodybuilder and you were like, but it makes me horny, like it's still a compliment.
I know. And I mean, partly I was like half kidding. I wasn't like, oh, you're my little bodybuilder, you know, jerk me off with your callous hands, you know? I wasn't like that. I was just like kind of having fun. Like sometimes, you know, I like to have fun and be silly and then I take it over the top. We were in bed the other day and I was having her stretch my scrotum as far as it could go. Yeah. And I'm 41. Like this thing, you can stretch. Like 9 or 10 like stories. Fun. Like it's far. I took her hand and I covered her whole hand with my ball sack because I thought it was funny. And she goes, okay, that's a little much. Like, she's like, I got to draw the line somewhere, and it's my hand being lost in your
parachute, like kindergarten parachute in gym class when you have like the massive one that everybody goes under.
Oh, dude, I love that game. What about the game with the big ball in the middle? I think they stopped playing that. A lot of kids got hurt.
People got like hit in the face. My favorite thing about having a boyfriend is playing with like a malleable, soft dick or balls.
Yeah, it's like a stress toy.
Yeah. Like there was one time Ben and I were like watching like sports or some shit and I was like playing with his little dilby and I was like thinking to myself, I was like, look at me watching like sports and playing with my dick.
Yeah, no, you just had to put a beer in your left hand and you fully transitioned.
Yeah.
Yeah, I just haven't been sex consistently with the same girl. I just haven't done that much in my life.
Mm-hmm. My computer's dying. I have to plug it in. Hold on. I'm still listening.
All right, I'll just wait. No, I guess that's pretty much it. That's all. Yeah, no.
You know what we'll do is Patreon or How Come fans. If you have more questions for Andrew Collin, maybe we can get you back.
Oh, for sure.
Okay,
for
great.
Sure.
And send in your questions. And yeah, we have that whole other episode. It's the live episode. You, me, and Nikki. That's still on Patreon. Such a fun time. So they can listen to that too if they want more Andrew. But until then, Andrew Collin, this has been so much fun.
Yeah, I've really enjoyed this, and I appreciate you having me. It's nice to see you.
It's so nice to see you.
I mean, through
From
a computer.
LA.
Yeah, LA, the birds. I'm actually going to be there May 8th through 20th, but
I won't be here, but that's cool.
you'll be on tour.
I'll be on tour. Oh my God, I wish.
With your nice back. Wow, you had to throw that in. All right. Yeah, no, I really did love seeing you, and it's just nice to, I don't know, see a familiar face.
Yeah, for sure. And hear a familiar voice, which they can do. They can listen to your podcast. Where can they find you online and your podcast? And
so my podcast is called Puddles with Andrew Collin, and then I'm also the co-host of the new the Nikki Glazer podcast. Woo-hoo. which is Monday through Thursday. It's pretty much daily, which
so fun.
Yeah, it's been cool. And then on Instagram, Andrew T. Collin.
Mm-hmm.
And yeah, I'll be over there having fun. And then we'll be on the road starting in July.
Amazing. And we made it through the whole hour without talking about our date.
I know. I just felt like we've talked about that a couple times.
A million times. No,
yeah.
That's why I was joking. I was like, we're not.
I almost brought it up.
Don't.
I guess
No, we can't. We can't. Never. But Andrew, thank you so much for being here. If they ask, we'll tell them.
Okay.
But at this point, you guys, any podcast that we're both on, we both talked about it.
We both
came on the date. No. Thank you so much for. Yeah, we both. I can't even talk about it. Andrew, did you finish?
Every time, except for most of the time.
Except for most of the time. Thank you so much for coming.
Thanks for having me. This is all I want to talk about. So it was great.
It was good. I think it was a good episode.
Are we done now? Yeah, it was
great.
Oh
yeah. Okay, yeah. Let's say goodbye. Goodbye.
Bye now.
No, to say it louder, like cuter.
Goodbye,
Cute.
bitch.
It's not you, it's me. I try so hard to finish honestly. They say you'll know when you go all the way from A right down to O. Oh no, I think that I still got a ways to go. Oh, I'm sick of this and I have got to know. How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. Oh baby, I believe these guests can help, 'cause I can't do it by myself. I wanna just